Hello and welcome to Health Check. I'm Claudia Hammond. This week, a very serious problem which affects millions of people every year, and a solution available at the fingertips of doctors here at London's Heart Hospital. Heart failure is when the heart muscle struggles to pump enough blood around the body. But I've come here to meet a man who thinks he's lucky to be alive. Ruben Naidu was just 33 when he had his first heart attack. Now in his 50s, he's been told he has heart failure.
I was immobile. I could not walk. To get out of bed was an absolute effort. I would have extreme angina, excruciating pain, would need help literally 24 hours around the clock. And Dr. Thomas gave me 12 months in February to live.
In the early stages of the disease, that's when you're breathless, when you're doing activities that you would consider normal, such as doing your shopping, washing, dressing, perhaps mowing the lawn. And as the condition gets more severe, you become breathless on more and more minimal exertion until the point where you're breathless, like you and I just sitting down.
A pacemaker can help to resynchronise the heart. The traditional way of checking the device's settings is to use an echo, where you scan the chest to see the heart pumping and alter the pacemaker settings if necessary.
The problem with that is that it has to be done at about 6 weeks' time, because after the implant the patient has quite a big scar and it's uncomfortable, and the probe we use is around that area, so it's quite tender.
A new device called a phenometer works by measuring changes in the blood pressure and cardiac output. It's far less invasive and less painful than the echo.
And then this is the little probe that goes on your finger. It doesn't hurt at all again. Okay, so I'm just going to slip it on there. It won't be too tight, but I need to make sure... The phenometer is a very easy method of replacing the echo and just being based on a little probe that's put on the finger to do everything that we can actually see from the echo pictures. So the advantage of the patient is that we can do it much earlier.
Dr. Thomas and his team used the information from the phenometer to adjust Ruben's pacemaker.
So if we could do LV first by 20, that would be great. So that's good news, Ruben. With the changes we made, your cardiac output is better.
I'm feeling very good today. As you can see, I could walk, which to me means a lot. And I'm definitely going all the way in trying to get to 100%.
Now it's time for some other health stories from around the world. Scientists hope that damaged knee joints could be repaired using stem cells as an alternative to joint replacements. Cartilage cells have been grown in a lab and injected into knees damaged by osteoarthritis for years. But now researchers in the UK want to find out if combining these cells with stem cells could produce better results. People lost twice as much weight in weight loss groups compared with those who just got help from their doctor, according to a new study. In a year, the people who joined a group lost an average of nearly 7 kilos. It's thought that obese patients do better in groups because of the regular weight checks, goal setting and support from friends. Losing 4 to 5 kilograms can halve a person's diabetes risk if they're overweight, so even a little can be beneficial. That's all we've got time for today, but if you've enjoyed this bite-sized version of Health Check, you can catch our radio programme over on BBC World Service. Find out more at bbc.com/health. But until next week, it's goodbye from Health Check.